It's been 162 days since the UK was first placed into lockdown, and although many restrictions have been eased, life still isn't what it used to be.
Well, our next guest, Professor Carl Heneghan, thinks the time has come for some normality to return, and he joins us now to tell us more. Well, I tell you what, that is music to our ears, if that is the case. But you do say that it is a mistake for people to think that it's completely gone away, even though the risk is less.
Yeah, look, I think we're in a position where there's lots happening right now. We've got schools returning, we're picking up people going back into the workplace, and then we're going to see universities in a couple of weeks' time opening. So we have to be vigilant, but right now we also need to be reassured that actually this is a different disease back in March and April. For instance, there are about 300 patients in hospital in England compared to 17,000 at the height of the pandemic. On Saturday, we reported one death across the whole of the UK. That's one death in 67 million people. So we should be reassured right now that it's safe. The environment is safe to go back to work, go back to schools. But we do need to stay vigilant as we go into the winter, because we will see a rise in all respiratory infections across the board.
So what is it that's happened then? Is it purely our social distancing and washing our hands and wearing masks and that sort of thing that has got these numbers down this far, or is it changing? Well,
I think there are two or three things. You're right. The social distancing, the hand washing, has a significant effect on respiratory infections. It about halves the number across the board. And it's not just for COVID. It's been other respiratory pathogens that we see normally at this time of year are much lower. So that's one issue. Second is the seasonal effect. As we go through summer, as we're outside, there is a natural distancing that occurs and the viral load is less. But what we have to do is be vigilant, because this virus particularly likes it when it's cold, when the humidity comes down. And that tends to be as we go into winter. So between now and December, respiratory pathogens will increase about 3 to 4-fold. But if we're vigilant, we can keep them numbers down. And that's the most important aspect here. A very clear, simple message. Keep the social distancing going, keep the hand washing going, and be vigilant. And I'd go with that 3 clear messages at all times.
Well, I mean, it sort of echoes what Matt Hancock has said. He said that a second wave of coronavirus in England this winter could lead to a nationwide lockdown again. So is it inevitable then?
No, look, I don't think there's a need for a lockdown next time. One of the reasons we went into lockdown was really because we were unprepared. We didn't have the test and tracing position. We had problems with PPE. We had problems across the board in terms of how we were going to manage it. So much uncertainty. We now have a different disease where we know much more about it. So I don't think a lockdown is inevitable. What I do think is much more we use some restrictive measures that are done in a way to slow down the spread if it does get out of hand. But a full lockdown to me would be an acceptance that we haven't learned anything in the first wave. And actually, we don't have these measures in place. And if you look at some of the countries like Spain, where they've had a resurgence, they've got these measures in place and they've managed to manage it. And so you always hear about when it's going up, but you don't hear, like in Spain, it's come down, cases have come down by half in the last week or two. And that's an important aspect. We're much better prepared.
Is it changing? Is it less potent than it has been in the past?
Yeah, well, what we're picking up at the moment is there's not been genetic changes in the virus, but what's happening, data out of Italy is suggesting that the amount of virus you're getting is much less. And when that happens, your immune system is better prepared to deal with the virus. The second issue is what's happened as we've opened up. In fact, we've normalized the risk so that many more younger people are now getting the virus who are unaffected in terms of symptoms and morbidity. So they don't get admitted to hospital, and that's important. And this is an important point. When we did go into lockdown, what happened is we managed to drive it into care homes such that 50% of care homes had outbreaks. Their outbreaks are much less now. So one of the key issues I'm looking in winter is a very clear plan for those most at risk, the most vulnerable, the care homes where about 40% of all the deaths occurred.
What about schools and universities? What's your view on them reopening? Because a lot of parents are still confused, maybe a bit anxious.
Well, look, I'll start with universities. There's been some concerns that it's not safe to go back to universities. Next week, I am going to be teaching face-to-face, and I'm really looking forward to that. I've missed it, and I enjoy that interaction. It is, in a way, if we do the right things, we can keep it safe. Now, if the data changes, we should respond to that, and there may be a need at some point for a pause in what we do. But we're using this as an opportunity to be creative, put some information online. We're looking at how we do some blended learning. Then we do the seminars, smaller groups, and our staff are responding in a very pragmatic way. When they can work at home, they are, but they're coming in about 50% of the time to interact with their colleagues. And I think that's the key here. It's the same in schools. What we have to do is going to be very challenging in schools, but not let our guard down. Often what you might see is people go through the day and then they come to somewhere like the coffee room and they let the guard down. And so it's important just to stay vigilant. And if we do that, we should be okay.
And of course, everybody is hoping that at some point there will, of course, be a vaccine. There's 3 trials in China at the moment, 1 in the UK, 1 in the US, a German-US partnership. Russian news agencies have reported that mass vaccination of high-risk groups in the country could begin in November, December. Are they going to win this race? Is that likely?
Well, look, if we're going to win this race, this is the time, because you're right, there's so many groups now who are trying to produce a vaccine. I think what's important about it is that the high-quality research is also ongoing. There's opportunities in the UK to sign up for the vaccine trials. The more people that do that, the more likely we are finding an answer quicker. And if we do the high-quality research here, we should be in a better place. And I'm hopeful that come sometime soon, just into the new year, we'll start to see answers emerging. And it's key. The importance about the vaccine is that it does protect those who are most at risk. And if that does that, then we should be hopefully in a better position. And I think by about March, April next year, we should be saying, actually, we're in a better place to reopen society for that summer.
All right, thank you. Well, how long do you think before we can actually hug each other?
Yeah, if I was a betting man, I'd be thinking May next year. I'd be putting my plans for summer holidays, thinking about what I do in that way, and we'll be shaking hands and hugging each other. But I want you to remember, if we stay vigilant, there are more diseases than COVID out there. There are influenza, RSV, all of these cause problems. And actually, if we take forward some of this social distancing, we will flatten out some of the mortality that we see over winter. And we often don't even pay attention to that. A particularly interesting area is just after Christmas, for interesting issue. It always see death rises at that point, because as we come together in Christmas, we see grandma, we tend to see infections rise and the mortality rise at that point. So I think there's something we can take forward for the future in terms of what we're doing now across the board for all infections.
Okay.
Thank you, Professor Heneghan.
Thank you.
Did you ever ask a question that you didn't want the answer to?
I know. Why did you ask that?
I know.
Don't ask that question
I'm not
again.
gonna ask that
Let's just
again.
day by day. We know that rule.